Parkinson's disease. Parkinson's disease is named after the late Dr. James Parkinson, who was the first to formally recognize the disease in his classic paper, An Essay on the Shaking Palsy, which he completed in 1817. His essay received little attention until the 1860s, when noted French neurologist Jean-Martin Charcot distinguished it from other neurological diseases and named it Parkinson's disease. However, medical experts have been studying it for thousands of years. Conditions like Parkinson's, or that may have been Parkinson's, are mentioned in the first Chinese medical text, Huangdi Ne Jing Su Wen, which was written more than 2,500 years ago. Symptoms and treatments are also mentioned in Ayurveda, which is an ancient Indian medical practice that has been around as early as 5000 BC. However, even after all these years of study, the true cause of Parkinson's disease is still unknown. Several factors seem to increase the risk of Parkinson's disease, namely age, family history, and exposure to various substances such as well water, pesticides, and viruses. Genetic factors also play a role. 11 genes have been associated with Parkinson's disease, and genetic forms of Parkinson's disease account for 10 to 15% of all cases. Parkinson's disease also occurs more often in males than in females. But what is Parkinson's disease? Parkinson's disease is a progressive degenerative disease that destroys the substantia nigra, which are part of the basal ganglia. As the cells of the substantia nigra are destroyed, there is a decrease in the production of the neurotransmitter dopamine by the caudate nucleus and putamen. The motor symptoms begin when approximately 60 to 80% of these cells destroyed or die. This leads to a decrease in dopamine production and causes abnormal activity in the basal ganglia, which are groups of gray matter in the cerebellum and are part of the pyramidal system. This is a critical part of the body that controls movements, and that is what caused the onset of the motor symptoms. These symptoms include tremor or shaking, loss of smell, small handwriting, trouble sleeping, trouble moving or walking, constipation, a soft or low voice, masked face, dizziness or fainting, and stooping or being hunched over. Perhaps it was best described in Dr. Parkinson's original text. Involuntary tremulous motion with lessened muscular power in parts and in action, and even when supported, with a propensity to bend the trunk forwards and to pass from a walking to a running pace, the senses and intellects being
Wow. That was a lot of information. But what exactly does it all mean? I've had the pleasure of working with patients with Parkinson's disease. In fact, some of my most memorable experiences have been with this specific patient population. Let's take a look inside the clinic so we can better observe some of the techniques used in the physical therapy world. Follow me. The first gentleman that I worked with did display some of the classic signs of Parkinson's disease. These signs included a shuffled gait, kyphotic posture, which made it difficult for him to look up and straight ahead, and a decreased affect or lack of facial expressions. Let's talk about that for a minute. This lack of facial expressions is sometimes described as a mask-like face. The difference between apathy or without emotions and merely having a mask-like face is that a person with a decreased affect still has the emotions. There's just something stopping these emotions from being fully expressed. Some of these characteristics involved with Parkinson's disease can feel overwhelming and raise questions such as, how do I communicate with this person? Or how can they communicate with me? I'd like to share some of my experiences and the responses I've received from these patients upon my initial greetings with them.
Hi, how are you doing today?
Well, I could complain, but who would listen?
Hi, how are you doing today?
Well, I'm able to sit up and take nourishment.
Hi, how are you doing today?
Well, I put my pants on the right way.
Silverman voice treatment originated as a treatment for people with Parkinson's disease in order to improve speech and swallowing abilities. The idea is that loud and prolonged voice sounds are used to improve articulation. Derived from this treatment is Lee Silverman voice treatment BIG. It's a type of treatment that pertains to the physical movements and uses big motions such as reaching and taking larger steps. Here's an example of this treatment.
Into your nose, do the best and back to me. Good. Now, with both hands at the same time, can you tap your thumb and your index finger as wide open and fast as you can? Pretty tough. Can you, with both hands, can you open, close?
This one does it better than this one.
Able to do that? Good. Now, with both hands open and
Can
close.
you hold your hands out in front of you?
Are
You able to
tap
do
your
it with
toe?
the other leg?
This is another one.
That's okay. That's okay. You're doing good? Okay. Great job. And now
Ready for
can
me
you
to
do
get
your
them
left
back
foot?
on?
Okay.
With regards to the treatments of Parkinson's disease patients, the biggest advance in treatment came in the 1960s, when researchers identified that Parkinson's disease patients had low levels of the neurotransmitter dopamine. Today, Parkinson's patients are treated with Sinemet, which is a combination of levodopa and carbidopa. Levodopa increases the dopamine levels in the brain, but has side effects such as tics and involuntary movements. Carbidopa decreases the side effects of the levodopa. These two drugs have been the staple of Parkinson's treatments for more than 40 years now, and when these two drugs are administered together, it makes the treatments effective for up to 5 to 10 years. Strangely enough, the ancient Indian Ayurvedic remedy involved the use of an herb known as cow itch, or velvet beans, which actually contains naturally occurring levodopa. Let's take a look at the molecular similarity between carbidopa.
This could go on forever, but that's about all the time we have for today. We hope we've provided you with some facts about Parkinson's disease, as well as provided some insight about the activities and exercises that can help Parkinson's disease patients in the physical therapy field.